Hello, and welcome to the symplr Education Series webcast. Today's webcast is titled Achieving Payor Enrollment Success with speakers Donna Gessencore and Dina Solis. At the end of this session, we will have time for a formal Q&A, but feel free to ask any questions as they come to mind via the chat box located on the right side of your screen. You will also be able to download the archive of today's webcast, its slides, and post-program materials at symplr.com soon, and we'll receive that download information in an email. We are so pleased to have experts Donna and Dina as our speakers this month. I'm sure many of you know them, and I'd love to turn it over to Donna now.
Wonderful. Thank you, Callie. Hi, everyone. Today's webcast closes out our 6th installment regarding the specialty of payor enrollment, which has included the framework by which it operates to help convey organizational clarity, an introduction into the process of enrollment, and tips on achieving payor enrollment success. Our first 4 sessions regarding this education in demand topic were held in 2015, and we've continued in 2016 with today's closeout introductory and practice process session. And Callie, just as a reminder to our listeners, are PDFs of all of the PowerPoint programs from this 6-part series still available on the symplr website?
Yes, they are. If you go to symplr.com and click on the resources tab, we have a webcast option, and you can download everything from the website archive, post-program material, and slides there on symplr.com.
Wonderful. Thanks, Callie. You know, it's important to note that from our very first session and throughout this series, we were the first and the only industry providers to host open educational webcasts on this topic. Through your consistent attendance, your great questions that we get during the program and after the program, and the positive feedback, your actions have been very, very clear. You, our wonderful listeners, have been the reason for this program's success. A special call out of effort goes to my innovative team at TMed Global Consulting, the generosity of Amy McWilliams, Callie Sutton, and the entire leadership team at symplr, and the expertise of Dina Solis at Sonoma Credentialing Services. As reflected on your screen, together we have indeed served you as educational partners on this journey of learning and discovery. And believe me, I've learned a lot with a lot more to continue to discover, but this has been educational, as I hope it's been as educational for you as it has been for Dina and myself. My name is Donna Gessencore. I've had a great time visiting with you on a regular basis while serving as one of your speakers during this webinar series. My colleague, enrollment process specialist, and your co-presenter today, well, that's Dina Solis, and it's my pleasure to introduce her again. Dina?
Thank you, Donna. Thank you for allowing me to co-present with you. I'm very happy to be presenting on this topic. I think it's really important to share the knowledge and the tips that we're going to be covering today, because as we know, a lot of what we learn is from shared resources, and I think it's really important to be able to spread the education and the tools that we've learned through the years, just to reinforce the teamwork that we like to present, and the sharing of knowledge, so we can all have success in payor enrollment. So we have a lot of material to cover, and I'm happy to turn it back over to Donna.
What are Dina and I excited about sharing with you today? Well, we're going to introduce you to the first of its kind payor enrollment organizational model. Mind you, it is still a work in progress, but it is the beginning of something wonderful that will be used to help educate our industry. It's really our goal that the introduction of this visual will help us all better understand why the process of enrollment is so diverse, ever-changing, and to many, even those of us who've been in the field a long time, we can find it confusing. This evolving reference guide, which you will see very shortly, is going to help you target your specific role in enrollment, and you'll be able to do it through the visual today. We're also going to provide you with links to Medicare and Medicaid that can be used as renewable resources. And as Callie mentioned, those resources will be available as a complementary to all of our listeners in our post-program materials. And then we want to freely share practice tips with you that can be immediately implemented to help with challenges you may be experiencing regarding commercial payers. So let's get ready. Look at the slide before you. I ask you to focus on the blue Post-it note. It's challenging all of us to try something new. And that may mean to learn something new, a new approach, to reach out to a person or a network of your peers, to learn from others, to begin to establish together proven practices that can help our industry. Who knows? Trying something new may just help us eliminate the experiences that I hear from our peers. And some of the comments that I hear from our peers go like this. There's no old school way, Donna, to teach you about enrollment because there are very few resources available. It's my way, but who knows if I'm doing it right? Another example, there's no common or typical way to enroll providers because the rules differ from provider type to payer type. And Donna, most of what I do is just my attempt at successfully enrolling providers without any delays. And that's the whole purpose of this series, is to try to help educate the credentialing specialist more about the nuances that enrollment specialists are experiencing and how we can collectively work together to get those practitioners onboarded as quickly as possible. Because we want to teach all of our listeners and everyone in the field about enrollment, I think it's important that we first understand that payer enrollment is not credentialing. And I know as I'm talking to many individuals, they have been mistaken, and I know some of your job titles even refer to you as credentialing specialists. But truly, credentialing is about verifying the credentials, right? What enrollment is the process of applying to health insurance plans or networks so the practitioner or the provider can be included into those provider panels, and that organization and health plan can then get paid for the services that are being rendered. And that's a very specific difference between the two. Credentialing is about verifying required credentials, and payer enrollment is about gathering those required credentials. So when we're submitting the applications to the payer, it is considered complete. Now, as I alluded to and kind of teased you as I began the program, I'm really asking you to think really big, because one of the things that I've learned from the field, from my colleagues, from enrollment specialists, is that there's a lot to know about the field of enrollment. And I always believe, and this has been one of my gifts, that I can take complex theories and subject matter and keep boiling it down to the simplest structure. Now, again, what I'm going to be revealing to you is work that Dina and I put together, and it's just the start, and it will continue to evolve as the industry evolves, but at least this is a visual that will help in our learning and our ability to communicate what we do to others. So the payer enrollment model that I'm proposing really looks as it does on your screen. There's 3 key components of payer enrollment: federal, state, and private and commercial. And it can be described as simply as those 3 components. But let's drill it down a little bit further, okay? Because who we're enrolling, meaning the provider types, and to what organization they're being enrolled for or by is the specialty lines. So looking at the visual that you see before you, hospitals have many different arms of service lines. It could be an academic center, it could be a health system, it could be a specialty hospital or a clinic or a critical access hospital. And these components that you see, and I know that there are others related to hospital, but again, we're trying to tee this up as a first perspective in trying to create structure for payer enrollment. So if you look at the hospital, you know that there are going to be provider types that we're going to be enrolling: physicians, PAs. And so it's important that knowing that you're going to have provider types and that there are enrollment specialists working potentially in all of these subsets of the hospital. And then we move into provider types for the ambulatory and rehabilitation areas. And so we have enrollment specialists working in all of these areas as well, because the services that they're providing, they certainly want to get compensated for, those providers as well as those organizations. Then we're moving into the physician and non-physician practice, and it could be a physician who's in solo practice or a PA who's in a solo practice, or there could be group practices or multi-specialty group practices. And I have to tell you, audience, that the calls that I received most frequently, especially since we began our webinar series, come from hospital enrollment specialists or credentialing specialists, or I should say, and staff that work in physician offices. And just as recently as last week, one of the individuals who is a manager in a physician's office indicated that, Donna, you know, since attending the webinar series that you and Dina have put together, I really now understand the difference between credentialing and enrollment. But gosh, there's so much to learn about enrollment. Where do I go? And so I know that there's need out there in the industry. And as we move into this program, we will turn on even more lights for our audience, but also provide you with all the known resources that Dina and I know, so you can reach out collectively or individually to get your needs met. In addition, we might find enrollment specialists in the independent diagnostic facilities, as you see here: sleep studies, laboratory, mammography, or radiology. And lastly, where we might find the enrollment specialists will be in durable medical equipment. And I believe, Dina, this is where you and I first connected, wasn't it?
Absolutely. This was when I was working for a large national durable medical equipment and pharmacy company about 5 years ago.
And so again, there are so many facets to the enrollment specialty lines that I think putting the visual there, it helps us all realize, especially those of us who are doing enrollment, that gosh, we're not alone. We really do have a wealth of information out there. And don't hesitate, as we said, learn something new. Don't hesitate to reach out to individuals within these specialty lines that you may be able to use as a resource. But as we now learned through this introductory model, the three components and the payors and the specialty lines or the environments where you would find enrollment specialists, I think the next logical question would be to ask Dina, so what comes first, the chicken or the egg?
Well, thank you, Donna. What I want to talk about first is the Medicare, the federal payer, which is Medicare. In terms of what you may ask yourself when you're enrolling your providers, which do I do first? Typically, I start with Medicare, but you can, if we can advance to the other components as well, you can begin the enrollment simultaneously. But typically, I start with Medicare, especially if I know that I'm going to be enrolling my provider in any Medicare managed plans, Medicare Advantage plans, because those plans typically ask for Medicare enrollment first. And also, state Medicaids usually will want Medicare enrollment first as well. That may not be true for all Medicaids, but depending on your provider type, most Medicaids would like to see enrollment in Medicare first. So I typically start with Medicare first. And then for your state Medicaids, those obviously, depending on your provider type, requirements change frequently and they can vary by state. So I typically would start that enrollment second, especially if my providers or my clients are wanting to enroll with any commercial or private county administered or managed Medicaid plans. Typically those payers will require a state enrollment first to participate in those plans. And then you can, as I mentioned, you can start your commercial enrollment simultaneously. You can even submit the enrollment to private payers at the same time and possibly be enrolled in a private or a PPO type plan. And if you are wanting to enroll in any Medicaid or Medicare managed plans, those can be added after the approval of those payers. So that's typically how I work with my clients. But depending on your organization, you may be able to work on those simultaneously.
And Dina, this is Donna. Did you also want to share with the audience the tool that we've developed that may serve as a good resource for our listeners?
Okay. In the part of the post-program materials, we're going to be furnishing a handout that is a matrix of all the state Medicaid websites with their contact information and some just basic information. And I find it very helpful because I'm dealing with national clients. You may not be dealing with national clients now, but it might be a helpful tool for you later if you happen to be working with providers in a multi-state situation. So that is something that we'll be providing in post-handout or post-program handouts and materials. So what I am going to be spending a good part of this program on is the private payers and commercial payers, because I find them to be the most challenging and the least amount of information available on enrolling or contracting with the private payers. So when I start off and I say that enrollment versus contracting on the first bullet point, I sometimes will refer to, or you might hear enrollment and contracting in the same, how am I saying this? You may hear both of those terms for the same process. So what I consider enrollment is usually when a provider is almost guaranteed enrollment into a payer's network. And sometimes that's, depending on the provider type, is not always the case. So there are times that you may hear me refer to in this program enrollment and contracting, and just knowing that those are sometimes can be interchangeable depending on the provider type. I'm also going to be talking about the importance of letters of interest and how those can be used as a selling tool of your providers to the payers. And I'm also going to be talking about preparing a good letter of interest and the components of what payers are looking for in the letters of interest. And then also we'll spend some time going over what happens if you've been denied network participation. So that's a really important component to this program, because when I was starting off, I found very little information about this process, and I found that not a lot of people were willing to share information about what can be done to try to help get your providers paneled. So we'll spend some time going over my suggestions and what's helped me in my practice with my clients. So Donna and I have basically branded the enrollment process into 2 steps. That we have shared some of this information in our previous programs, but we will go back into some of them and also elaborate a little bit more. But the pre-enrollment process involves certain steps, and then we also have come up with a post-enrollment process that we will go over. So in pre-enrollment, you may have seen some of these bullet points before if you've attended some of our previous programs. The first step is to determine which plans to enroll in. The second step is contacting the payer and asking questions. I have a core set of questions that I'll be sharing with you that I typically ask payers before I start the enrollment process. And the third step is collecting the provider information and documentation. The fourth step is just obtaining and completing the application. The next step we'll spend a good amount of time on is preparing the letter of interest. And now when talking about these steps, some of these steps can be interchangeable. So the little side note is that some payers will want a letter of interest first before an application can be submitted. So, or maybe a payer might want ask for a pre-application where it's just maybe a 1-page application. So some of these the processes are still the same and the tips are still the same, but just know that some of these steps could be interchangeable. But typically the letter of interest could be first, or it could be included with your enrollment packet as well. And then you'll submit the enrollment packet to the payer, follow up until the determination is made, and then we'll spend some time talking about network denials and what that would look like in the next steps. So getting into the first step, we have covered these before, but depending on your organization, determining which plans you enroll in may be predetermined. If they are not, I've discovered a helpful resource, which is a directory of U.S. health plans, and that can be found at aishealth.com. And what it is it's a tool that's basically a manual that is available in print, CD, and also a little drive, the little zip disk, or not zip disk, but the flash drive. And it basically outlines all the health plans in the United States, and it can be broken down by state. It has demographic information, and it's a very helpful tool that I've found with my clients. If Medicare, you can go to this Medicare website to get applications, which would be cms.gov. If you're using PAYOS, you would go to the PAYOS website to enroll in Medicare. And like I said, if you're enrolling in state Medicaid websites, we'll have the handout with all the Medicaid state websites and contact information. Now, like I said, I have a core set of questions that I ask payers when I'm enrolling. I just used this yesterday when I was contacting a payer for a client of mine. And what I ask typically is if there's any special requirements for my provider type or special licensing required. Sometimes you can find this on their website, the payer's website, but there might be some nuance or something. You might be enrolling an out-of-state provider, and it's always just good to ask. Enrollment fees. You could have an enrollment fee associated with your provider type. It's always good to ask about this, this component of your enrollment. Just yesterday, I clearly saw on the payer's website that there was an enrollment fee associated with my provider type, but when I called, the payer told me that they were no longer requiring the enrollment fee. So that was good because it saved my provider $554, which is the enrollment fee for coverage year 2016. The next question I ask is how long the typical time frame is for processing, because as we all know, payers' processing time frames vary. So that's really helpful to ask, even if if the payer clearly has it shown on their website what their time frame is, because sometimes payers will have a backlog of their enrollments that they may be 6 or 8 weeks behind schedule. So I've had that happen. So that's a good question to ask. Asking what their preferred submission method is. Again, this was very helpful for me to ask yesterday because it was clearly stated on the payer's website that we could email the application, but this person told me on the phone that email is the slowest way of getting the enrollment processed, which was surprising to me. So he shared with me that their email was running a little bit slower, and that faxing or US mail would be the best way to submit, which I found interesting. But if it's a paper application and you're sending it, I would suggest always getting the street address, even if the payer indicates on their applications or on their website that there's a PO box to send, because a lot of times they'll also have a street address. You'll also want to ask if if the payer uses CAQH. That might be indicated clearly on the website, but that's a question that I've asked before. If the payer permits backdating, if so, how far back? Again, this varies by payer. I've had some payers tell me they'll backdate up to 30, 60, 90 days, 365 days, so that just really varies by payer. And then regarding the fee schedule, most of my clients, for my particular experience, want to know if some of their CPT codes or their HCPCS codes, the fees, what the payer is willing to pay for those services. So usually fee schedules are available on state Medicaid websites, and I don't typically have to ask for those, but for commercial payers, if your provider wants to know ahead of time what the fee schedule looks like, that would be something that you could ask for. Also, some private payers will take a percentage, your rates may be a percentage of the fee schedule. So sometimes that's helpful to ask for as well, so your providers know in advance what they're going to be paid for their services before they take the time to enroll. I've had some providers say they don't want to enroll with certain payers because their rates are too low. So this is helpful to ask ahead of time. Regarding forms, these are just simple forms that you may need to ask for. An EFT is an electronic funds transfer agreement, and that allows the providers to be paid electronically. The ERA is electronic remittance advice, which allows the provider to receive the remittance electronically rather than being sent paper. And the EDI is the electronic data interchange, which is basically electronic billing. So some of these forms may not be readily available on the website. You may have to ask for them. You may have to ask to be redirected to a different area on the website. That's one of the questions that I ask. And then number 10, finally, if you're dealing with an out-of-state provider, it's very important to ask if the payer allows out-of-state providers. And this is important for me and some of my clients, the provider's payment can change if they are located out of state. And what I mean by primary versus crossover is I have a client that is an out-of-state provider to many state Medicaids. And some state Medicaids will only reimburse certain provider types on a crossover to Medicare claim basis and not a primary claim basis. So some of the Medicaids that we're dealing with, that I deal with, only allow, say, a 20% copayment to Medicare versus a patient who may have a primary insurance be the state Medicaid. So in those cases, if the provider's out of state, the provider might not get paid for those primary patients. So that's a question, an important question that I ask for my clients. And then if there's any special requirements for out-of-state providers. And what I mean by this is that there may be special revalidation or re-enrollment requirements for out-of-state that may not pertain or apply to in-state providers. So meaning revalidation on a quicker time period. Certain in-state enrollees usually are about 3 years for revalidation requirements, and I've had out-of-state provider requirements typically about a year or 2. So it's usually shorter for out-of-state providers. So that's just a question you want to ask. Step number 3 would be just basically collecting the provider's information and documents from wherever they are stored in your organization. You want to review them for completeness and accuracy. You want to check on the U.S. Post Office website to make sure that those zip codes and the zip +4 code matches up to what's on your application. And then checking the names and addresses and expiration dates on any licensure supporting documentation against what the provider has put on their application or what might be in their CAQH, just to make sure that there's no typos and that they all match up. So the next step would be to obtain and complete the application. So this we've covered some of these elements before, but just as a quick review, within the application there's instructions, which obviously would be a good reference for some questions. They ask for identifying information, typically licensure, certifications, affiliations, references, practice information, liability or malpractice insurance is usually asked for. Pretty much everything that would be on a credentialing application is usually on an enrollment application. Such as, well, with the exception, some of these would be like what the billing information is. Your provider may use a third-party administrator or clearinghouse for their billing or for receiving payments. There's typically attestation questions, ownership information, information release, provider agreements, the EFT agreement. Some payers will require electronic funds transfer agreement to be paid electronically as a condition of enrollment. And then also there's a checklist of attachments. Some typical attachments would be very similar to credentialing. Typically a payer would ask for a W-9 proof of liability or malpractice insurance. If the payer requires Medicare enrollment or Medicaid enrollment, you would need the proof of their welcome letter or their enrollment letter. And then, as I mentioned before, the enrollment fee. So here we'll talk about the letter of interest. So the letter of interest, or the LOI, the importance of it is that some networks might be at capacity or full. And so the letter of interest really helps present and sell the provider to the payers. It describes the overview of the services and can be used to persuade the provider to offer enrollment or a contract. So typically what I do is I will, rather than first of all, addressing my letter of interest to a particular department like provider relations, I'll try to find out the exact name and the address of the decision maker. And how you can do this is by just calling the provider, or the payer, or sometimes I've found people on LinkedIn. And the difference, just in noting the difference between a contract manager versus a network manager, you'll find these depending on the payer organization, but typically you'll want to be looking for a contract manager or an enrollment manager or a specialist in the contracting or enrollment, because the network manager is typically somebody who manages the network once the enrollment or contract is processed. So just knowing the difference between those two terms can help you find the right person. So the basic elements of the letter of interest, it should be typically 1 to 2 pages. And it should first show the provider's identifying information, like their name, their service address, NPI, tax ID number, CAQH, the type of specialty or services, and the service area that they cover. What I like to do, this isn't typically required, but as a selling tool, I usually like to include a little bit about my provider organization, how long they've been in business. It can be helpful to know if, for the provider, if they're family, or for the payer, if they're family owned or corporate owned. And some of the elements that I usually include that are helpful to help sell the provider to the payer is if that provider works with specific hospitals or medical centers that are contracted with the payer. So that can be helpful in knowing that maybe that particular provider has a working relationship with organizations that are contracted with that payer, and just being associated with that organization, maybe doing some name dropping can be helpful. You'll want to indicate in your letter of interest any special attributes. Sometimes being a minority or women-owned small business, having that certification from the United States Small Business Administration website, you can go to that website for more information. Sometimes that can be helpful. Any type of unique services compared to competitors that might be offered by that provider can be helpful. Anything unique, like a geographic service location, maybe that provider works in a rural area that doesn't have as many services offered in it. And going on to the next slide. Maybe the provider works with a specific patient demographic. Maybe the provider works with low-income patients. Maybe they specialized in what's called dual eligible, which is Medicare and Medicaid eligible patients. And that's a specific market segment that is elderly and low income. So when we're dealing, if you deal with the Medi-Medi patients, that might be helpful. Any type of patients that have special needs, maybe pediatric special needs patients, that can be helpful to payers to know that you service that type of demographic, as well as Indian Health Services or IHS. And depending on the provider type, maybe they offer some sort of referred services, or that they refer services to a provider that is in network with that payer, such as DME, home health, or hospice. Another selling element can be if the provider if they can possibly offer competitive rates. A word about this, if you know what that payer's rates are like, maybe for that provider type, I've been able to be successful by offering rates that might come in a little bit under what the competition offers. So just trying to offer the payer something a little different than your competition can be helpful, like a pilot or test program. I've worked with clients before that have offered, say, a test program for maybe a core set of 10, 20, 50 patients, and stating that they can offer the payer like a cost savings of, say, 10%, and guaranteeing that to the payer is very appealing and enticing to payers. So that might be something that you might be able to offer.
Dina, before you go on to the attachments for the letter of interest, as you're describing the various things that could be included in this letter of interest, from your process, do you start with a template and then you have fields that you cut and paste into your kind of template?
I have a certain format that I use, but I wouldn't say that I cut and paste because really my letters of interest vary. I really try to tailor them to each provider. Okay. So, I mean, I have a certain format that I use, but usually, and it's very similar, but like I said, you really should tailor your letter of interest to each provider.
Okay, and the reason I ask is obvious. You know, we're just from even the credentialing perspective, we're trying to streamline and trying to automate as many of our steps as possible. So from the enrollment side, the nuance, it sounds like a good idea. You want to perhaps have sort of a template, but you don't want to be submitting a letter of intent if it's filled with things that provider isn't capable of doing. Right. And that's why it's so important that you match those attributes of that provider, of that physician as an example, with that payer, so they feel that it's a mutually beneficial arrangement.
Exactly. Yes. Yeah. I always think of it in terms of when it comes to private payers particularly, I like to try to highlight what my providers can do for that payer. So it is mutually beneficial. So payers, they get hundreds, if not thousands of letters of interest a month, I'm sure. And they're always getting hit up for enrollments and contracts. So it's really important to try to highlight what your provider can do differently. If your provider type is not a customary automatic enrollment. And this can be helpful. This information on the letter of interest can be helpful if your provider is denied as well. So you may have a situation, our attendees may have a situation where they're getting denied on the initial enrollment. You can use some of these tools to go back and appeal that decision by trying to sell your provider to the payer and offer something a little bit more to the payer. So moving along to the attachments, these are just, depending on your payer, they may ask for a W-9. They might ask for some marketing materials about your provider. They may ask for I've had payers ask me for the top billing codes and the rates that we're looking to be paid for the services. And sometimes that's a dollar amount, or it could be just a percentage off their fee schedule. I've had payers ask for invoices on products that my clients have provided, and those are products such as like durable medical equipment. This isn't usually typical for other provider types. And I've had payers ask for a sample claim form. So you just have to ask what they're looking for. And this step is pretty self-explanatory. The enrollment packet would be your application, your attachments, your cover letter, or your letter of interest. Submitting it to the payer via their preferred method, or if it's online, making sure that you get your username and password, and just knowing if you're applying online what the ATN stands for, it's application tracking number. And the next slide, following up until the determination is made. And this is really just about communicating with the payer, keeping your stakeholders updated, responding to any requests for additional information, making sure that you do that in a timely manner, because that helps expedite the process. And if you're approved, you may need to ask, not all payers will send an approval letter. You may have to ask for that. And then if you're denied, you can go to step 8 for some more tips. So if you're lucky, you've never had an enrollment denied, but unfortunately that's not what happens in the real world. I typically do get denials and have to dig a little deeper because, like I said, a lot of payers, especially nowadays, are trying to keep their networks narrow, and they're having to do more with less also. So payers will evaluate their network on a quarterly, yearly basis. Evaluating for network need is what it's called. And so what you should do is not just ask why, but you can ask the payer, go back and ask why, but it's pretty self-explanatory in the first denial usually. But if you find out a little bit more information, you can sort of find where you might be able to fill a need, because there might be a canned response that you get saying, I'm sorry, our network is full, it's at capacity, we'll keep your information on file. So sometimes you can go back and you can ask, you know, how often do you evaluate your network? Sometimes you can, what I typically do is I don't usually take no for an answer, especially the first time. So I will get some letters together, maybe from patients, from colleagues, and from referring physicians, meaning if my clients, their services are provided based on a referral basis, I will get, and this can be from physicians, it can be from case managers, I will get letters, supportive letters, that support that provider being enrolled in that network or contracted in that network, that payer's network. So I don't usually, like I said, I don't usually take no for an answer the first time. You can appeal and reappeal, meaning this basically just means submitting your request again and again. You can ask for a single case agreement, or what's also called a letter of agreement. And typically these are done through the case management department or the prior authorization department at the payer. They're done between one of those departments in your organization's billing or insurance verification department. And that's what I'm meaning in IV, insurance verification. You can ask the payer for a trial basis. I've had clients who have agreed to maybe furnish services for a particular patient, a particular demographic or geographic area for a specific period of time on a trial basis, meaning sometimes my providers are willing to kind of give something away in order for the payer to see how well those providers take care of their plan members. So sometimes that can be a helpful tool. You can offer discounted rates, like I mentioned before, and trying to kind of come in under what the competition might be offering. Sometimes it's helpful to find payer colleagues on LinkedIn. And what I typically do is I don't start with the top of the food chain. What I usually do is try to find somebody who's typically a specialist, maybe a provider relations specialist or an enrollment specialist, or I usually would go up to like a manager first, because typically they're usually more willing to share information and to get back with you. And so they're usually they can more willing to give you information on who the decision makers are. And then really it's kind of a matter of just kind of gently bugging them and keeping in constant communication with them, because sometimes I've had success just being a squeaky wheel. So it really you just kind of have to keep submitting your information, keep checking back, and just being persistent.
And before, Dina, you move on to the post-enrollment steps, I'm going to circle back around to my question that I had asked about the template on this letter of intent. And I recognize that you are a consultant and you have all types of provider types, and you apply to all different type of payers. Because so many of the calls that we're getting are from doctors' offices, would there be more logic in having a template of a letter of intent because you're working with the same group of physicians who potentially are providing the same type of service? Or even...
Yeah, absolutely. That would be very helpful to have a template.
Okay. So that, and I'm trying to get this frame of reference for our listeners. So from your broad perspective of being a consultant, you have to know a little bit about a lot of different areas. From the world of that enrollment specialist who works specifically in a hospital or specifically in a doctor's office or with the durable medical equipment, they would have more consistencies or similarities on how they're processing or how they're gathering that information for those different payers. Is that an accurate description, or help adjust it if it's not?
Oh no, yeah, I definitely agree with you. I think that you can definitely get some sort of a template together based on your organization and the provider types that you're working with. So that would definitely be a very helpful tool to develop within the attendees within their organization. So.
And just like a credentialing specialist is always looking at ways to automate their verification piece, as an enrollment specialist, if there would be a way that you can standardize some of your enrollment process, that again is another selling point to your administrator or to your boss, that you kind of got it on the ball. You understand the process that well that you've been able to carve out some additional steps that may not be necessary.
Right, and then even if your organization already has a letter of agreement established, like a template, it would be good to just take some of these suggestions and go through it and just see if you can fine tune it a little bit.
Got it.
Yeah.
Yeah, that's a great tip then. So thank you for answering that question. As you were talking, I was trying to find the correlation, and I was really gathering that the distinction really was your world as consulting, and you have to be diverse in so many other areas. And still, enrollment can be confusing, but our jobs truly as professionals is try to keep them as simple as possible so we're not overcomplicating the process.
Exactly. And we're all in this together, and like I said before, when I was first starting out, I had a really hard time finding information like this, and I found it, the people my resources, who I thought, or where I thought were good resources, really didn't want to share information like this. And so I'm really glad to at least be able to share the tips and suggestions on our processes. So going into the post-enrollment process, this is a real quick slide. It's just basically obtaining proof of the enrollment, implementing your enrollment or your contract with your billing department, and that can mean getting any assisting with any applicable applications or paperwork related to electronic processes. Recording or loading your new contract or enrollment documentation into a database if your organization uses it, updating your system, getting any type of documentation into your system, ensuring also that your provider is loaded into loaded and recognizable in the payors network system, because a lot of times payors, their network system and their contracting and enrollment department don't communicate very well. So you can have an executed copy of a contract in hand and still show for a period of time the payors network system that they may not be enrolled. So just making sure that your communication with the payer is in check. And then the last step is just making sure that you're staying on top of any post-enrollment changes, updates, licenses that might need to be submitted to the payer, proof of insurance, and or reattesting with that payer.
Wonderful. Well, I know that we covered a lot of information, but for the purpose of getting ready to kind of close out this particular session, I want to just remind our listeners that we really did introduce to them this new enrollment model that includes the providers and the payer and patients and service lines. Any other ideas that you all have on how we, remember this is a work in progress, so any other ways that we can capture things that we perhaps didn't include in that model, Dina and I would love to hear from you. We also talked about the links that, the worksheets that Dina put together that will be available on the symplr website as Callie described. So those are our extra goody tools for you for being such loyal listeners. And then we talked about the pre and post process tips that will really help you enroll with those commercial payers in a more effective manner. And just as Dina described, you know, going to the slides that describe the components of the letter of intent, match it kind of with what you're doing. Are there fine-tuning pieces that you can do in your process? Can you eliminate some of the steps in your process that may not be necessary or required? So it's all about, again, better understanding, working to an improved methodology that will get our practitioners credentialed and enrolled and onboarded so the revenue can come into that organization, to those providers in a more expeditious manner. We promised you some industry resources, and again, we have done a lot of research, and there are not a lot of resources out there that we, Dina and I, have been able to find, but what we do know is what we're sharing with you now on these slides. symplr, by way of this webinar series, would be a great resource. Callie mentioned to you that there's a whole source of blogs and information available on their website. In addition to my company, which has been the producers of these webinars, Dina's company, Sonoma Credentialing Services, would also be resources, and we, believe us, we get a lot of questions after our webinars, and we try to answer all of them. Sometimes if we know we're going to be addressing that content in the next webinar, we don't personally reach out, but if by chance we've missed any of your previous questions, you know, please jog our memory again, because we pride ourselves in our follow-up. And then the resource that Dina mentioned to you, that Atlantic Information Services, that has information on all the various health plans. The website is depicted as there on the screen. And then Decision Health, and we discovered this into our first or second webinar session that we did, but they do have 3-day workshops available a couple of times a year, but it would be best to check out their website and identify perhaps how you can gather more information specifically on needs that you may have, a specific question you have, a nuance that you might be experiencing, or for an overall understanding by attending the workshop that's coming up here in April. We also want to, meaning Dina and I, want to leave you with kind of reinforcing what we learned in the beginning, right? Or what we introduced in the beginning, is trying to learn something new every day. Not just learn something new, but try to learn something new every day. As I mentioned, this entire series has been a learning experience, because when you put information together on slides, you want to make sure that you vetted it, that it's accurate. And so I want to thank you, our audience, for kind of keeping Dina and I honest as we've been developing these programs. I'm going to continue to move through the slides. We do have a couple of minutes, so I'm going to ask Callie if she can kind of coordinate perhaps 1 or 2 questions while I describe to our audience that the next webinar that I'll be hosting is Reasons to Automate and How to Be an MSP Rock Star. So whether you're in enrollment or you're in credentialing, this might be a program that you'd want to participate in. So mark your calendars. And now a word from our sponsor, and hopefully, Callie, this will work when I click it. And if not, I know you're there to do it live.
Yes, ma'am. Oh, doesn't seem to have any sound. This is a quick YouTube video that you can find on YouTube if you search for symplr. This basically shows you the overview of our payer enrollment services. Symplr does have that service to offer you in order to help get your payers billable up to 2 times faster. If that's something that it sounds like your facility is interested in, please email us at sales@symplr.com. That's sales@symplr.com. I would like to reiterate again that the webcast archive, the slides, and the post-program materials will be online soon at symplr.com in the resource library. Make sure to add communications@symplr.com to your address book to ensure that you get the emails with these links. All right, let's see. Let's do a question. Let's see. How often do you follow up once the application is submitted?
Well, it would depend on the payer, but typically, it depends on the method of transmission. If I'm faxing something to a payer, I'll follow up in the next couple days to make sure it was received. I've learned the hard way when I don't do that sometimes they don't get received. So if via fax, definitely follow up within a couple days to make sure it was received. Depending on the payer's time frame, if the payer is at 120 days for processing, I might follow up in 30 days. If the payer is telling me they processed in 30 days, I might follow up in a week or 2. So it really just kind of depends on what the payer's time frame is. So, but after that, like I said, it just depends on the time frame that the payer has established. So hopefully that helps.
All right, thank you, ma'am. Another quick one. On the LOI, many payers want the practice to sign them. Who signs these letters when you send them out?
I usually sign them for my clients. I don't think I've ever had a payer tell me that the letters of interest need to be signed by the actual provider. That might be a question that you would want to ask up front to the payer, but typically I'm the one who signs it because I'm the contact person for that provider. So again, making sure that if you're concerned about that, to make sure you ask that up front of your payer.
All right, thank you, ma'am. In fear of running too far over, I'm going to hold the rest of the questions. To everyone whose question we did not get to, I will be sending these over to Donna and Dina. They can reach out to you or they will send me an answer, and I will make sure that you'll get your questions answered. I know we had a couple roll in real late, and we are so sorry that we didn't get to them this time around. But in one way or another, we will get your questions answered. And from symplr, I'd like to thank y'all for joining us and that we hope to see you in April. Donna, Dina, is there anything you'd like to say in closing?
It's just been a great experience, and thanks for following us.
Thank you for attending.
All right, well then I believe that should conclude today's session, and we just hope that everyone has a great rest of the day. Thank y'all.